The main benefit of grandfathering your plan is that non-discrimination does not apply to you. This is an important concept both for small employers who are offering coverage and for all large employers in the fully insured market. This is something that applies to self-funded plans. So the difference being self-funded plans means that the employer is funding the medical plans, they're paying out on the medical costs, medical claims. When the plan's fully insured, the insurance company is paying those medical claims. And so this is applied to those self-funded plans, meaning that they can't discriminate in favor of their highly compensated individuals within their company. So they can't give their top executive many more benefits, health benefits, than they can to their lower, or all the rest of their employees. The law now applies this to fully insured plans. And this isn't in effect yet because Treasury has delayed it until they issue more guidance on it, because this is a pretty complicated piece of the law. But the important part is that it could have a big effect on this industry. We have a lot of folks who offer management-only plans or management carve-out plans, either because your hourly folks who've been offered the coverage choose not to take it, or you're using it as a benefit and a retention and a recruitment tool for your managers. And so management-only or management carve-out plans are pretty common in this industry, and there's a question if they apply the rules that apply to self-funded plans as they are today. If they apply those same rules, we might have a problem with those management-only plans going forward, as well as tiering plans. It'll be an individual company-by-company evaluation, because you'll be looking at wages and the value of the benefits and who's getting what and that sort of thing. So this is something to definitely keep an eye on, both for small employers who are looking to offer coverage, as well as large employers subject to the mandate. This is coming, I think, even potentially in the next month or so. We might have to see some sort of rules on this going forward. There are a whole bunch of new reporting and notices and taxes and fees in this law that affect everybody as well. If you are offering coverage, small or large, you've probably heard that and your payroll vendor may have helped you provide the value of the coverage on the W-2 for 2012 tax year. Those with 250 or more W-2s had to do that for 2012. For 2013, everybody has to do it if you're offering coverage. And so something that appears, it's not taxed. That was something that early on, that was a big point of discussion. Whether or not this was taxed is not taxed under this law yet. There's some other fees, and a lot of these drive up the costs in the small group market, in the fully insured space. There's a comparative effectiveness research fee that's $2 per capita in the plan. There is a exchange reinsurance fee, which is $63 a head in the plan. And this is something that only lasts for 3 years, but we're hearing that actually when you do see what your rates will be, this might be line items by the carriers, because they want you to know that it's not all their rate increases, it does have to do with some of these fees. So when you're looking at your documents, you might see this spelled out for you. There's also a health insurance tax that's applied to the health insurer carrier. And we know that this is going to be passed along to those in the small group and the individual market in terms of higher premiums. So another cost in terms of driving up the premiums in the small group market for smaller employers especially. And then for those offering coverage, come 2018, there is an excise tax on the value above a certain dollar amount of coverage offered. And so for self-only coverage, for single coverage, $10,500, is the limit, and $27,500 for +1 or family coverage. And so anything above those values is then taxed at 40%. So they're squeezing you definitely at both ends, especially come 2018. There's some new taxes that apply to kind of everybody, and this one especially to pass-through entities, which are common in this industry. If you're filing your business and your personal income taxes together. There's been a 3.8% tax on earned income, but they are now applying a 3.8% tax to unearned income. And that includes cap gains, rents, royalties, net investment income. So something you may have encountered already with your CPA this year as it started January 1, but it applies to those with $200,000 filing as a single, or $250,000 married filing jointly. There's also additional FICA tax increase on the employee side for those above $200,000 or $250,000 in income. You probably had to adjust your payroll for some of this if this you fell into this category as well. Okay, let's talk about the employee experience, because this applies to everybody in terms of what your employees are going to be faced with, and what even not all of us are going to be faced with in terms of the individual mandate, what the exchanges are, and some information about that, and maybe some questions that your employees are going to be asking, and some things to think about, whether you're large or small. So there are two ways this law really increased access to coverage, and that's what it really was about. It's through the individual mandate, and it's through the Medicaid expansion piece. And we'll talk about that in a second. But the individual mandate, this is what was part of the subject of the Supreme Court case. And it says that most Americans, almost all Americans, have to obtain what's called minimum essential coverage for themselves and their dependents, or face a tax penalty. Minimum essential coverage can be a lot of things. It could be certain qualified coverage through the employer, and we'll talk about what that does to meet, what that is that meets the employer's requirements, as well as it would meet the individual's requirements. But it could be Medicaid, it could be Medicare, it could be TRICARE, Veterans Administration care. It could be another state program. It could be, through their spouse. They have it through their spouse's employer. You can get it a whole host of ways. But minimum essential coverage is the standard in the language that is used, and actually what I think will be on the tax forms, which everybody will be reporting in terms of the individual mandate. If you choose as an individual not to obtain coverage for yourself and your dependents, there is a tax penalty applied of $95 or 1% of income in the first year, whichever is greater, $325 or 2% of income, or in 2016 it goes up to $695 or 2.5% of household income, or of income. Again, whichever is greater in this sense, and these are indexed for inflation after that, the 695 is. So it's important to understand what these penalties are and compare them to what employees can obtain in terms of your offer of coverage, if you are offering coverage, or in terms of the exchanges and what they can purchase there, maybe with subsidy or without, depending on their income. So especially in the first couple of years, $95 a year sounds like a pretty good deal versus, especially for somebody who's 23 and thinks they're invincible and doesn't need to go to the doctor, and yep, I'll just pay that $95 and I'm not going to worry about it. So it's important to understand people's choices and some of the dollar amounts of it surrounding that. So what are previous exchanges, or healthcare marketplaces, as they've been renamed recently, they're basically marketplaces where you can buy coverage. And so think of it as a Travelocity or an Orbitz or a online shopping website. It will be a website. There will also be phone options and other ways to contact the exchange. But there's an individual market as well as a small group, which are called SHOP. And I cannot remember what SHOP stands for, but it's a small business part of the exchange. And each state defines what that small group market is. It's either 50 or fewer employees or 100 or fewer employees. Most states are at 50. The exchange, on the exchanges, plans have to meet a certain level of coverage. They're called metal levels. You've probably heard bronze, silver, gold, and platinum. They refer to the richness of the benefits that are offered at those levels. So these designations only apply to the exchange coverage, what's offered there. It doesn't apply to employer coverage. That's a completely separate measurement. There are 10 essential health benefits that must be included in every plan that's sold on the exchange. Hospitalization, emergency services, maternity and newborn care, prescription drugs, rehabilitative services, and even pediatric services like oral and vision care. So there are some things in there that aren't necessarily typical of a lot of employer plans. So that's why I made the designation. This doesn't apply in the large group employer market. This is only if you're buying coverage on these SHOP exchanges. Exchanges come in a couple different forms. The law says that each state must set up its own exchange, and if they don't, the federal government will come in and run it for you. And here in South Carolina, that's the decision that's been made, is that you'll have a federally facilitated exchange. The feds will run and set it up and do all the work here in the state. So you will have an exchange, but it'll be run and operated through Washington, D.C. They must be self-sustaining by 2015, and so it's an important reminder just to think about how they would fund this, and that always means taxes and user fees and things like that, and something to keep an eye on going forward. And in 2017, states can choose to open up to groups of 100 or more employees, a group of 100 or more. So larger employers could potentially purchase coverage on the exchange in future years, but not for a couple years after implementation. The important date to know is October 1st, 2013. That is the first day that the exchanges will be open for business in terms of folks being able to shop for coverage. We think, based on the experience shared by operators in Massachusetts, that a lot of employees will begin to shop for coverage. They'll begin asking you, what are you offering? How much does it cost? What does the exchange offer? Can I afford that? And potentially go through that eligibility process for subsidies and Medicaid. So the open enrollment period is October 1 to March 31st this year to next year, just in the first year, but it's typically October 15th to December 7th in following years. So this is the open enrollment is the time that people can sign up, and then the plans begin January 1st. So what happens when an employee goes to the exchange? They are going to present the exchange with a whole bunch of information, both on themselves and their family, as well as about their employer. They'll be asked for social security numbers and their legal documentation, those documents, their green card numbers, things like that. Birth dates. They'll be asked for the employer tax ID number, income information. They'll be looking at pay stubs, W-2s, what have you, that they will give to the exchange, and the exchange will evaluate their income levels. Because and any health information as well, health policy information. Because what the exchange will do is evaluate their eligibility first for Medicaid and then for subsidies at the federal level to purchase coverage on the exchange. Here's the form that they'll be asked to fill out. It's 21 pages at this point. And this is coming from the Health and Human Services Department, but it looks a lot like a tax form for sure. Step 1, tell us about yourself. Step 2, tell us about your family. What's their income? Where do they work? What coverage do they have? What do they pay for premiums? If you have multiple persons in your household, they'll ask you, okay, person 1, then person 2, then person 3, dependents and the like. Your family's health insurance, who has been offered coverage, who's on it, who's not. Maybe the parents have it, the children don't, but what have you. Native American or Alaskan Native, there's questions about that. Read all this and sign the form and submit to the exchange. It says, congratulations, you're done. What happens next? Well, they run the evaluation and determine, as I said, if somebody's eligible for Medicaid. And this is where the Medicaid expansion comes into play. As I understand it, South Carolina has chosen not to expand Medicaid, so this is not necessarily something that's going to apply in the state, but Medicaid to this point has been a program that applies under 100% of federal poverty level to about 80 categories of people. The states have control over this. And so that's the first filter. And if somebody is not qualifying for Medicaid, they'll then be run through the eligibility for a federal subsidy, and that's for folks between 100 and 400% of federal poverty level. And I'll give you the numbers in a minute. What's important to understand, again for everybody, whether you're a small employer or a large employer, because small employers are going to get these notices too, is that the exchange is going to notify the employer if an employee obtains a federal subsidy. The reason being, if you're a large employer, it's the federal subsidies that trigger the employer penalties. So you're going to get these notices from the exchange, and I assume many of you are probably just within the state, but if you're in multiple states, you might be getting these from multiple exchanges. And you can think about what that means for the largest companies in the industry that are receiving them from 50 states in the district, and from franchisor and franchisee situations where the franchisor might be getting the franchisees notifications. They're not even the franchisor's employee. So a lot of confusion, a lot of paperwork. You're not required to respond to it. You do have the option of responding and challenging that determination within the first 90 days when you receive it, but you don't have to. If you're a large employer, there is another process in terms of the penalty assessments and challenging that at a later date with the IRS. It's not the exchanges that will assess those penalties. So just know that there's some communication coming from the exchange, and that depending on how many employees you have and how many do go to the exchange and apply and get a subsidy, you might be getting these notices. Here's a notice that the employer, most all employers, must give to employees about the exchange. And this is one where I think really facilitates employers being a source of information for employees. Everybody subject to the Fair Labor Standards Act must notify their employees, all employees, their current as well as their new hires going forward, about the exchanges. And there's some very specific information that you'll be asked to provide, how to contact them, how to contact the exchange, what it means for an employee not to turn down employer coverage because there's a tax benefit to employer coverage, what it means to get coverage on the exchange. So it's it's taxed. It's not, it doesn't have that tax benefit from employer coverage. This has been delayed. It was supposed to go into effect March 1st, but the Department of Labor issued an FAQ and said, we're delaying this until at least late summer, early fall. And the reason being was that the states hadn't made all their decisions about exchanges, so they had nowhere to send you or send your employees. So once that's known, once the states have now made all their decisions, if they've notified HHS, they'll be able to say, okay, here's the South Carolina template, and here's what you as an employer would do to send your employees here in South Carolina to the exchange.